Hi, and welcome to the Restorative Wellness Clinicians Corner, a video series exclusively for functional health professionals, where we interview the top experts in the latest research, products, tools, and best practices for getting your clients exceptional results. So welcome everybody to today's episode of the RWS Clinicians Corner. We are here with Dr. Tracy Gapin, and we are going to talk about all things male health, especially male hormonal health, and talking about kind of male, like high performance male hormonal health. So Dr. Tracy is a dear friend of mine and a fabulous clinician. He is a board certified urologist, world-renowned men's health and performance expert, the founder of the Gapin Institute, and a global leader in high performance health. He has over 20 years of experience focused on men's health optimization, human performance, and longevity, providing executives and entrepreneurs a personalized path to fulfill their highest potential. He's been featured in Entrepreneur, The Good Men Project, and as a TEDx speaker. He's the best-selling author of Male 2.0 and Codes of Longevity, a member of the American Academy of Anti-Aging, Age Management Medical Group, and the International Peptide Society. And we are so excited to have you here, Dr. Tracy. Welcome.
Oh, thanks so much. Glad to be with all of you this evening.
So I want to start from the beginning. Tell us how you became interested in functional health specifically, because as I understand it, you started off in the conventional world, correct?
Correct. Yeah, I am a recovering urologist, I like to say. So I spent 23 years in traditional medicine in a high volume, very busy urology practice, operating, doing robotic surgery, taking out kidney stones, doing vasectomies, all that fun stuff. About halfway through my career, I had some health issues of my own, which is typically what triggers someone to make this kind of change. And when I found that traditional medicine really had no answers for me, that got me searching for myself and going down rabbit hole after rabbit hole, learning about, first it was epigenetics and precision medicine, learning how to really apply personalized genomics to individualized health. That got me into peptides. That got me into functional medicine, regenerative medicine, the whole world of anti-aging and integrating technology with wearable tech. And I started putting all these pieces together, not only for my own health, but for my patients. And I started running a purely cash-based program for men's health optimization on the side while I was still running a very busy urology practice. And that grew and grew and grew to the point where I was spending probably half of my week doing that work that I love so much, and the other half of the week doing the urology work that I really grew to dislike. And so I finally made the very life-altering decision to jump off a cliff, figuratively, and leave traditional medicine. And I launched the Gapin Institute for High Performance Health about 2 years ago now. And our doors finally opened about a year and a quarter ago now, and we've taken off. We've exploded, and my goal is to really transform men's health and to create this concept called high performance health, where we're not just satisfied with getting you from disease, illness, symptoms to neutral, but how can we optimize you? How can we really make every part of your mind and body operate at the highest level? And so I see men and women at the Gapin Institute. I get to see all the men, and my nurse practitioner gets to see all the women. So that's lovely for me. And I see guys come in with really the same 4 complaints over and over again. They tell me, I want to have more energy, I want to lose weight, I want to have better sex, and I want to live longer. And so I've doubled down on that. And so, Margaret, those 4 things is really my passion now. That's what I do. And seeing amazing results. And the secret is really, it's putting all those pieces together that no one else is really doing when it comes to men's health.
I'm really excited to dig into this. I'm really excited. So let's talk. I mean, we know broad brushstrokes, all of us here are in the functional health world, right? So we know broad brushstrokes about what's really different about the approach when it comes to, what you were doing as a conventional doc to what you're doing now. But tell me, share some things that maybe really surprised you the most that is different even from what a lot of functional practitioners might think when it comes to male and men's health specifically.
Yeah, great question. So every other men's health doc out there focuses on testosterone. It's all about testosterone. And that's really the emphasis. You go to any, men's health center in air quotes around the corner, and they're there to give guys testosterone. And I think that it's fair to say that we have a testosterone epidemic going on where levels have plummeted about 50%. Free T is down 50% over the last 20 years. And so it's a real problem. But what's the why? What's the cause behind it? And to me, that's really the big thing that no one is touching on. And looking at things like gut health and cortisol, and looking at things like, nutrition, stress, sleep. Sleep is so underappreciated when it comes to men's health. And these all have a massive effect on I call it our human operating system. And so just giving a guy testosterone is not the answer because you're not addressing the underlying why.
100%.
Yeah.
And what do you think is, you've talked about this idea of the pandemic of low testosterone. Like, what do you think? Yes, stress. Yes, more toxins, poor diet. Is it just the accumulation of all of that? Or is there like what's going on that we're just seeing such, and it's such young ages, right? I personally do not specialize in men's health in my practice, although I still do have a few male clients. And even in the small number of male clients that I have, I am seeing andropause younger and younger ages. It's alarming.
Yeah, I see guys in their 20s who come in with like minimal testosterone levels. Like we're talking like 180, 200, and it's out of control. And I will tell you that it's hard. I'm hard pressed to find a man that walks through my door that has optimal testosterone levels without help. And so what's the cause? There are a lot of causes we can look at, but without question, the biggest single culprit is endocrine disruptors.
Okay.
In their environment, we can look at our crops that are sprayed with atrazine and glyphosate. We can look at our personal care products that are loaded with chemicals. We can look at plastic water bottles. Our drinking water is poisoned with synthetic estradiol from women's birth control that we're drinking. And I call it this endocrine disruption soup that we're bathing ourselves in on a daily basis, from the clothes we're wearing to the foods we're eating to the personal care products to the food container to the water, everything. And it is layer upon layer upon layer. And that's just one piece of it. When we look at toxins, how it's crushing our health, but no one's touching on it. No one's talking about it. There's no attention put on it when it's such a big deal.
It's a critical piece. Yeah. It's kind of a gross image, that endocrine disruption soup, but it's very accurate. We're just sort of swimming in it, aren't we?
Yes.
People think male health, they think testosterone, exactly as you said. So I want to talk about testosterone here for a moment. We'll start there. And I want to unpack other hormones as well, but let's start there, because I think also there's a misconception about testosterone, that it's about sex drive, libido, vitality, muscle mass, but its implications are much further reaching.
Oh, yeah. Yeah, without question. There are over a dozen published studies that very clearly show the link between low testosterone and cardiovascular disease. Mm-hmm. And we can look at quartiles of testosterone levels and see very clearly that men in the lowest quartile of testosterone levels have about a 30% increased risk of a major adverse cardiac event, heart attack, stroke, DVT, PE, over the men in the highest quartile. And so we know that low testosterone is associated with higher LDL levels, higher triglyceride, insulin resistance, worsened sensitivity. It's associated with vascular disease, and so there's no surprise that it's clearly tied to longevity. So yes, it's going to, optimal testosterone is going to be helpful for sex drive and for building muscle and burning fat and energy. But it's cognitive function, it's mood, it's a guy's energy, it's the way a guy shows up every day at work and at home, as a dad, as a husband, as well as his long-term survival as well.
Mm-hmm. Can you speak a little bit, because we hear about this with the cardiovascular disease. Do we know the mechanism of what it is about low testosterone that's driving that? Because you listed a whole number of correlations there, but do we know actually the mechanism specifically of what that low T is doing?
I don't know that it's clearly been defined. I can imagine that it's clearly related to endothelial dysfunction. It's related to nitric oxide production. It's related to insulin sensitivity as well. And so I think that you can extrapolate from all that how it would lead to cardiovascular disease. But I don't know that's necessarily been directly, causally tied to any one of those. Yeah.
Right. Well, I figured if anyone would know the answer to that, because I've never heard the direct mechanism explained. So I figured if anyone knew the answer to that, it would be you.
Yeah, good question.
So let's then talk about, let's continue about testosterone for a moment first. Now, in the medical model, I see, when clients bring me labs done by other practitioners, they often bring in, they will have their hormones done, but it's total testosterone.
Yeah.
Can you talk about, the total versus free? And then can you also talk about, because we here at RWS, we do a lot of like salivary testing. We do the Dutch test. So can you speak to testing for male hormones and like
Sure.
What's your preferred methods? And if not serum, what other ones do you like the best?
Yeah, I'll start with where you ended there, and that is the debate over salivary versus blood testing. And we do both, actually. I think both are valuable. We do a lot of Dutch testing as well, which I think is helpful. I think that's more looking at metabolism of testosterone, specifically, estrogen breakdown and all that, and estrone. So I think that's definitely valuable. We do a lot of blood testing. Simply, that's where I started, and I think most of the literature is correlated with blood testing. Yeah. But the key there, as you brought up, is free testosterone is the money. That's where it's at. And so, to explain that, just to be sure everybody's on the same page here, we have testosterone molecules floating around the bloodstream. Testosterone, to do its job, has to actually get into the cell, whether it's a muscle cell or any other type of cell, has to get into the cell through the cell wall, has to get into the nucleus of that cell, and then affect DNA transcription to ultimately have its physiologic effect. Well, there are proteins floating in the bloodstream that can bind to testosterone molecules, and now you have this big fluffy molecule of testosterone bound to a protein that can now no longer get into the cell and do its job. The most common protein is SHBG, sex hormone binding globulin. And sex hormone binding globulin is this big molecule that, when attached to testosterone, prevents it from having any physiologic activity. Other proteins like albumin, it's a weaker bind to it, so sometimes it can actually release. Whereas SHBG, when it binds to testosterone, it's stuck. It's like glue. You're done. Mm-hmm. And so the testosterone molecules floating in the bloodstream, there are a couple analogies that we use to describe this. One is the testosterone molecules that are bound to proteins like SHBG are like soldiers without guns. They can't help you. They can't do anything for you. Or a construction worker without a tool belt was one a patient shared with me that I'm like, it's inactive. It can't do anything. And so that's why we care so much about the free testosterone. And most doctors, all they do is check total testosterone, which in my mind is actually fairly worthless without understanding the free.
Now, when you are looking at serum, do you do both free and total? Like, is there an ideal ratio, or do you just care about the free?
Excuse me. We'll do both. We'll check SHBG as well to see where that is. Okay. But the free is typically what I'll go by. You'll find that the higher the SHBG, the higher the total you'll need to achieve the optimal levels of free that you'll want.
Right. And then when you're supporting the hormones, you're not really trying to find an optimal ratio. You're really looking at the free itself, The free itself. Exactly. Yeah. Now, a lot of guys ask that this lens, begs the question, well, how do I lower SHBG so that I can then just get a higher free? Can I just do it that way? Unfortunately, there's not a lot of great options for that. There's no direct way to directly lower SHBG. Something like stinging nettle root may help a little bit with that. Every time I've tried that, results are pretty marginal. And so, unfortunately, sometimes it just requires that we get the testosterone total that much higher to overcome the SHBG. Let's shift to other hormones. What are the other hormones that you're looking at for your male clients?
Oh my gosh, it's like a symphony. So we look at testosterone, obviously, and we can talk about levels after this if you'd like. Yeah. We look at testosterone, we look at thyroid, we look at growth hormone. As IGF-1 is a great surrogate to measure growth hormone function. We look at cortisol, obviously, is massive. We look at vitamin D, which technically is a hormone. Mm-hmm. We look at nitric oxide, which is tough to actually directly measure. Obviously, we look at estrogen. We look at progesterone, although we don't really tend to do too much work with progesterone in men. We look at insulin. Obviously, fasting insulin is massively important. So many guys have issues with blood sugar regulation. So we look at that one as well. Those are the biggest ones I'd say we focus on. There's so many labs that we draw, but I think when it comes to hormones, those are probably the biggest ones that we pay most attention to.
That's excellent. So you mentioned levels, and let's talk about those levels. So, where are you wanting someone's free testosterone to be? And we'll talk in serum for the moment, just
yeah, sure. Yeah, we'll do serum. So when you look at that lab slip on the right, you'll see that reference range. I think it's really important to understand this, which will help you put my answer into context. So I'll start with this first, that the reference range is not the healthy, optimal, ideal range. I don't know if anyone knows where that comes from, but the reference range is simply the average from that lab, right? So LabCorp does 1 billion testosterone levels, and they say, what is the average? That's the median. And then they look to statistical standard deviations on either side of that. And that range from top and to bottom, think of a bell curve, you have standard deviations. That statistical range is your reference range. And so it's nothing more than the average, okay? Well, we started talking about testosterone, pointing out that testosterone levels have plummeted by about 50% over the last 20 years. We have a massive study here in the US. There's one in Sweden and one in Finland. All three of them show pretty much the same thing, that free T is down anywhere from 35 to 50% over the last couple of decades. So knowing that fact and then knowing how the reference range is created, you can now imagine that bell curve keeps shifting lower and lower every year. And so our quote reference range, we are lulled into this complacency that these crappy levels are okay when they're not.
Right.
And so the reference range that I'll see will say something like 70 to 212 or something stupid like that when it comes to free testosterone against serum levels. My goal for free testosterone is anywhere between 200 and 250. And if it's 260, fantastic. But we definitely don't want it below 200. So the answer is really, long answer short, is we want to do free T between 200 and 250 in men.
It is. We talk a lot about this in our blood chemistry class. We talk about the difference between those functional and optimal ranges versus the lab ranges. It's alarming. It's interesting. You can see such a difference from lab to lab just around the country based on the health of their population. So it's crazy that that's how we gauge quote unquote health. It's not actually health. Let's talk. When you're now, are you looking at all of these typically to start, like, for example, cortisol? Would you be looking at that through a serum as well? Or are you going to be doing that through like a salivary?
No, that's all salivary. Yeah. So we'll do either the HUMAP or the Dutch or just direct straight cortisol testing. Because so many of the guys I work with, these are high performing men, they're entrepreneurs, they're executives, they're athletes and high stress guys, and cortisol is almost always an underlying problem. And as you know, it's not just affecting testosterone, it's affecting visceral fat, insulin sensitivity, gut health, and so on. And so cortisol is, when I look at working with men, I think of it of layers of systems that need to be addressed. And for me, hormones without question is the first thing that these guys need help with. And once we can fix that, then we can start working on the other pieces that they're going to be so much more responsive to.
Right. Excellent. How are you now? You mentioned nitric oxide, and tough to measure. So how are you measuring that?
Yeah, I don't have a great way of measuring it. And so it's not a lab test that we specifically do. We do recognize the effect that nitric oxide has, especially on sexual function, but we don't have a great way, unfortunately, to measure that.
Okay.
Yeah.
So this is clearly much, much more thorough than what you would get in a conventional medical workup. Are you ever looking at any of the other, I think about some of the salivary tests, for example, they're looking at the androstenedione or the DHT. Are you looking at any of those, or even on the Dutch, you see the metabolites and things? Are you
for sure
those in your?
Yeah. So the estrogen metabolism is certainly applicable to men as well. I think that there's this misconception, first of all, that estrogen is the enemy in men, and it's not. We need estradiol, and estradiol has clear cardiovascular protective benefits. And so a lot of guys will come in and they're already on Arimidex, an estrogen blocker, and I will pretty much stop it immediately in almost all men I work with. There's very rare cases where you actually need that. But what's important is sometimes a man's estradiol level may be healthy, optimal, okay, not a problem, but the metabolism is such that he's going down that 4-hydroxy pathway or 16-hydroxy pathway, where we need to really work on that, knowing that sometimes that can cause symptoms in men as well.
Yeah.
And so we look at that. We do look at the DHT. We do look at the ratios, the 5-alpha reductase, 5-beta reductase. I look at methylation, COMT on the bottom of the page there as well. I think all that's important, and there's no men's health providers out there looking at Dutch testing in men.
No,
It doesn't happen. Yeah.
No.
Yeah.
Yeah.
And
Do you think that that's because of the testosterone is hard? You're not going to be managed. Like the logic I follow as well, if they're primarily focusing on testosterone, they're likely providing exogenous sources of testosterone. And I know the Dutch isn't the perfect way to measure it, because it doesn't, that exogenous testosterone won't necessarily show up in the testosterone itself. It could just appear through the epitestosterone, if I'm understanding that correctly. So I've always assumed that when you're supplementing with these hormones, that's not the best way to test. Do you think that's part of the reason, or is it just like they're just not acknowledging the importance of these?
They don't recognize it at all. And I'll tell you, traditional medicine, this is a debate that I've had with a lot of practitioners, is traditional medicine does not believe in any salivary testing at all.
I know.
And so I've had that debate with them. I think there's definitely value there without question. I'm on your side here for sure. But looking at the back to the cortisol, the DHEA to cortisol ratio, I think is critically important. Looking at the estrogen metabolism is important. Looking at the 5-alpha reductase, 5-beta, the alpha beta breakdown, all those are super important, and they all kind of play into this bigger picture, if you will. And so it's not just simply giving the guy testosterone.
Totally. So let's talk. So, our audience here is practitioners. Male client comes in the office. When should they think hormones? Is it like always, or are there certain signs and symptoms that they should be paying particular attention to that would trigger them to go down this path?
Yeah. I see guys in their 20s, 30s, 40s. Mm-hmm. And I have a large peptide practice as well, by the way. And so a lot of guys come in wanting peptides. And my question, well, why? Why would you like peptide? Well, I want to build more muscle. I want to burn fat, want more energy. Mm-hmm. So they're always looking for that magic pill. But when we back up and actually do complex lab testing, we end up finding there's hormone problems behind that. And so to answer your question, almost any guy coming in when they're complaining of issues with energy, issues with body composition, issues with sex, issues with cognitive function, any of those things should be really a tip off that there's probably something going on with hormones.
Mm-hmm. And I would imagine mood would be another one. Maybe you lump that in with cognitive function, but mood.
And what? Oh, mood. Yeah, for sure. Depression, anxiety. Absolutely. Yeah.
Okay. You work definitely with the hormones, also with peptides, as you said. Yeah. Those are out of the scope of practice for a lot of these practitioners. Yes. So tell me, do you think it's possible to move the needle for male hormones using like really strategic dietary strategies, really targeted supplementation protocols, lifestyle factors? Like, is it possible to get them there, or do they need the?
I think it's a great question. So, can natural approaches to health improve testosterone levels? Yes, 100%, absolutely. However, what I see is men coming in, a 35-year-old guy has a free T of 55, and I need to get him up to 200, 250. Okay. Am I going to be able to do that with fixing his sleep first and foremost? Am I going to fix that, getting him strength training, helping him with stress mitigation, helping him eat the right foods with the right micronutrient supplementation? Yeah, it's definitely going to help that. Am I going to get him to get rid of the toxins in his environment? Absolutely, sure. Am I going to get that from 55 to 200? I say that's an incredible challenge. It's very hard to do that. I think it's important to honor the fact that these guys need, in my opinion, a balanced approach. They need the lifestyle stuff without question. And if you just give them testosterone peptides, you're failing.
Yeah.
But I find that the lifestyle stuff is typically just not enough. And I'll put it another way. These guys, when they come for help, they've already lost their drive. They've already lost the momentum. They've lost their energy. And to turn that around, sometimes you need a kickstart.
Mm-hmm.
And for me, fixing the hormones is that kickstart to where now when I'm talking to them about the lifestyle change they have to be making, and when my RWP and FDNs who work with my clients talk to them about those and go through the functional tests, they're much more receptive. They're able to make those changes and do what they need to do because they now have the momentum moving forward.
Yeah.
And so there's some nuance there where yes, you can make a difference with natural approaches, but is that enough? Typically, I just don't find that it is.
Right. And it's interesting because I think of it, they're more open to it. They're probably more capable, right? Because they actually have the energy and the capacity.
That's right. It's like we use a lot of semaglutide. Okay, peptide, FDA-approved peptide for fat loss. And there's a lot of criticism around semaglutide, some potential side effects, which I think are fairly minimal. But the key is, do I think it's a magic peptide? No, but it's going to get these guys heading in the right direction now to where they're going to be more willing. They're going to be eager. They're going to have the guys need something to get them going. And when they start to see some change, now they're going to be much more likely to eat the right things and get off their butt at lunchtime and go train or wake up early and train and go to sleep at the right time. All the things that they need to be doing. Now they're going to be much more motivated to do that.
Let's talk about some of the natural solutions. Now, I'm going to ask a question that I'm just going to be honest. If someone asks me this, I get annoyed. So you can get annoyed with me because I'm going to ask you to generalize. But I'm also going to ask you to help. We have, as I said, we're talking to a bunch of practitioners, so they know a lot of things here. But if you're to think about dietary levers, supplement levers, lifestyle levers, like think about our toolkit that we're working with right now.
Yeah.
In each of these three categories, which are, in your opinion, the most important ones and or the ones that most people, including functional practitioners, don't give enough credence to?
I think sleep is without question the absolute single most important thing that guys need to focus on. Sleep is massively important when it comes to, balancing cortisol, when it comes to repair and recovery, when it comes to hormone function. There was a great study out of, I think it was University of Colorado, like maybe almost 10 years ago now, where they took these college kids and deprived them of sleep, just kept them up all night. And their testosterone levels went down 50% in one day.
Oh my God.
One day, like massive. One day, yeah. So we know that chronic sleep deprivation is massive when it comes to hormones, especially testosterone. And you can understand the mechanism through, raising cortisol, increasing inflammation, improving or reducing insulin sensitivity, decreasing your mood and desire to make the right healthy lifestyle decisions. You can think of all the reasons why, but I would say that that's the most important thing. And so when you ask me what are the things I would focus on, number one, the biggest thing that I would say, if there's any take-home message for sleep, go to bed the exact same time every single night without exception. Nights, every night, weekday, weekend. Pick a time. That's your time to go to bed, and you need to plan in advance of that time. So let's say for me, that bedtime is 10:30. Mm-hmm. There is nothing to eat within 3 hours of bedtime. Nothing to eat, nothing to drink unless you need a sip of water for your pills. Nothing to eat or drink within 3 hours of bedtime. Blue light goes off 2 hours before bedtime. That means laptop, phone, tablet, computer, anything. If you want to watch TV, I really recommend blue light blocking glasses. And then 1 hour before, you have a couple things that you can do. You can read, 4 things. You can read.
Yeah.
You can journal. Mm-hmm. You can meditate, mm-hmm. or you can have sex.
Love it.
I would not do all 4 of those at the same time. It's really weird. But you can do any or all of those 4 things in that last hour before you go to bed. And that is a regimen. You could also, there's some great data there, anecdotal data on sauna use before bedtime as well. And a lot of people think that using sauna in that hour before you go to bed is much more powerful than it might be at other times of the day as well. So that's an option for you there too.
Love it.
So without question, sleep is the biggest thing. I am a fanatic about that and tracking it as well. So I'm big on wearables, and so I love Aura. I like Garmin when it comes to every other data point. Sleep is sometimes hit or miss on Garmin. I love Whoop. Again, sleep is hit or miss there as well. And then the other devices I would say would be a little lower on the food chain.
Right.
And the goal there for tracking, we want to look at deep sleep and REM sleep. So different stages of sleep, obviously the REM, and then there's non-REM, there's light sleep and deep sleep. And we want to look specifically at deep sleep, which is really the key restorative aspect of sleep that we get in the first half of the night. And then the REM sleep is typically more in the back half. And we typically want 1 hour of deep sleep. So 60 minutes of deep sleep is what you should target. Mm-hmm. And then 120 minutes, 2 hours of REM sleep is the goal as well.
Wow. So good. So good. I think that's great advice for pretty much everybody. I love the regimentation of it, like just the discipline of it. Like this is what happens, and you build your life around it, and there's no exceptions. And I think that's excellent. Any other pieces? So sleep, hugely important. What about exercise? I think of, and timing of exercise. Like, are there nuances around training that we can bring to clients?
Yeah. So most of the guys I work with have very poor fitness, and they're busy, they're traveling a lot, and they will train when they can. And I think it's so important. This goes back to, you talked about regimentation with sleep. I'm so big on living with intention and living your best life by scheduling it. Mm-hmm. By making, these are the big rocks, the non-negotiables in your life, and everything else has to fit in around that. And so for me, I actually have in my calendar blocked out times to work out.
I love it.
And so my team knows that they can't book me during those times. It's just not an option. And I actually will commit to a trainer 2 days a week as well. So I train, or I exercise 5 to 6 days a week, and 2 of those days are with a trainer. I pay them in advance, so I have to show up. Yeah. And I'm blocked out on my schedule for those times. And so the timing of it, I really don't care. I think that it depends on the individual. I'm not a morning person. I've tried to wake up at 4 a.m. and I just can't do it. I'm just not a morning guy, and my workouts don't work for me. And so I work out at lunchtime. And so I block out times in my day to do that during the week. Or after work, I'll go, I can go for a walk if it's low intensity day. I think it's important to balance. You need strength training. Most guys don't do nearly enough strength training. They're doing too much aerobic and not enough strength. You need to lift heavy stuff, especially when it comes to testosterone. You need to be lifting heavy weights. Strength training is really a key. And then add in some interval training, maybe, 1 or 2 days a week as well.
Okay. I can see that there's lots of questions here in the chat, so I want to make sure we give time for that. But I have a couple more questions for you.
Yeah.
Just the reality in our community is that the vast majority of our practitioners are female. Bringing up hormones and some of these topics with male clients can feel daunting, awkward, So do you have any tips for female practitioners speaking to male clients in a way, like how can they have these conversations in a way that helps make their male clients feel really safe, really, ready to lean in and do the work, be really honest with them, and not feel awkward?
Yeah, I think being straightforward, being honest, being casual with them about it, and that it's probably more uncomfortable for you, the practitioner, than it is for the guy. And that, the guy is there for one of those 4 things. Typically, those 4 complaints are 99% of the complaints they're going to have. And you can tie testosterone and hormones to every one of those complaints. And so I think, we're obviously here to help people and to provide that transformation. And so I don't think it's awkward at all. When I occasionally work with women, which I try not to, but when I do, we'll talk about hormones, and it's part of life. It's part of a human, and we're about optimization. How can we help them be your absolute best again, and that involves fixing hormones. And so when you look at it that way, I think it takes away any of the weirdness. Yeah.
Yeah. Okay. I want to go to questions here in the chat, and then I'm going to come back to you with some more questions here. 1 second here. Clarifying question. You mentioned, was it stinging nettle root that you said you had marginal results getting?
Yeah, that's right. Yeah, it's the herbal stinging nettle root. There's been a study or two out there that suggested that it may help reduce SHBG. My clinical experience has been not great with it. Yeah.
Yeah. Okay. Ellen's asking, would essential amino acids help increase testosterone if it increases muscle mass for those that don't absorb dietary protein well?
Protein well. Well, I think essential amino acids, you're talking like BCAAs, like pre-workout kind of thing. I assume is what this question is.
I think I would imagine that's what she's talking about.
Yeah. So I think it's good. I mean, I think what I can extrapolate for you is we know that training big muscles is helpful for improving testosterone. So specifically, when we talk about lifting heavy weights, it's legs, it's quads, it's hamstring, it's back, it's core. All those big muscles are what we want to focus on when it comes to trying to increase testosterone. And so whatever it takes to build those muscles. So I guess indirectly, perhaps BCAAs are going to help you potentially improve performance and improve your workout. And so indirectly, I guess so. Do amino acids directly increase testosterone? They don't know.
Okay. Kim is asking for optimal levels for other hormones.
Yeah, sure.
So you mentioned a lot of different hormones. I've got the whole list right here, so we could go through some of the key ones here. So
yeah, so thyroid is a big one for me.
Yeah.
I look at free T3. I think all of you do as well. I would assume. Yeah. So for me, free T3, I aim for around 4.0, 4.2-ish, somewhere in that kind of ballpark range. A lot of guys will come in, their free T3 is 2.8. Mm-hmm. It's incredible how many men walk around with subclinical hypothyroidism and don't even realize it. And all they have is a little bit of low energy, some belly fat, and they have massively diminished thyroid.
How are you supporting that specifically? Are you working with, are you giving like thyroid medication, like Synthroid or Armor or something like that? Or are you working with?
I don't ever use Synthroid. I hate Synthroid. I would never touch Synthroid. It's T4 anyway, but typically it's gut. And so when we see thyroid issues, typically it goes back to cortisol, it goes back to cleaning up the gut, fixing micronutrients, nutrition, stuff like that. And then sometimes they also may need some thyroid support as well. So I may sometimes give compounded thyroid. If I do, it's always T3 and T4.
Right.
But I recognize that a lot of times it's the result of another problem, not the problem in and of itself.
100% agree completely.
Yeah. So that's thyroid. So T3 around 4.0, 4.2, free T4 around 1.5 would be my target on that. Growth hormone IGF-1, typically like 150, 200-ish would be a good target for that. I don't want to ever get too high with. I don't want IGF-1 to be too high. I don't ever prescribe growth hormone directly, typically. I know there's a lot of guys looking for that. I try to avoid giving exogenous growth hormone due to some potential negative consequences of that. So that's that. Cortisol, I do salivary cortisol, 4-spot salivary cortisol testing. So same values that you guys look at there.
Yeah.
That's
what about your vitamin D?
What's that?
What about your vitamin D?
So vitamin D 60 to 80 is my target for that. Fasting insulin, I do. I want that to be typically under 10, under 12 or so. Nitric oxide we can't measure. What else? Estradiol is a good one. So a lot of guys come in and their estradiol is like 10. And I'm like, dude, what are you doing? And they were given Arimidex by other prescribers out there, other providers out there, because as I mentioned before, everyone thinks estrogen is the enemy. It's not the enemy at all. And so I will immediately take them off of Arimidex, and the question is,
Can you clarify what that is? It's an
I'm sorry. So Ormadex is a anastrozole, and what that does is that blocks the aromatase enzyme. So testosterone gets broken down, or gets metabolized, I should say, excuse me, in fat by the enzyme aromatase. And so that's how testosterone gets metabolized into estradiol. And so Ormadex or anastrozole will block that enzyme, so it will make your estradiol levels plummet. Mm-hmm. So I've seen a lot of guys come in with ED, depression, low mood, low libido, specifically because of low estradiol.
Wow.
And so I want to emphasize, it's crazy. And so estradiol is not the enemy. We want to really let the estrogen come up with testosterone. So visually here, a lot of guys will come in and their estrogen will be way up here and their T is way down here. And so when you have that imbalance of, estrogen's too high in relation to the testosterone, that's where you get the belly fat, you get the metabolic syndrome, you get all the issues with libido and energy and so on. Excuse me. My goal is to get that testosterone level up to the high optimal level like we talked about. Estrogen's going to come up with it. I'm okay with that. And so guys ask me, well, what's your upper limit for estradiol? And I'd say 1 million. It's 1 million. I don't typically care because, again, it has cardiovascular protective benefits. We want estrogen. And so there are times that we may want to lower it. So if a guy's having symptoms, side effects from it. So occasionally some guys can get some breast tenderness, gynecomastia. They can get some they get teary, crying over, get super emotional. And that may be a sign their estrogen is too high. Most guys can tolerate. I've seen guys with estradiol levels 60, 70, 80, completely asymptomatic. And I do not lower it just because I'm afraid of that number.
Interesting. So then you're not thinking about kind of any kind of cancer situations or things like that. Maybe when you're looking at Dutch to look at metabolism and looking at the way that.
Exactly. Not all. And I want to clarify also that there's this misconception that as a urologist I had as well my entire career until the last couple of years, that testosterone causes prostate cancer. And they thought that maybe it's because testosterone actually converts into estrogen and the estrogen causing the cancer. In no uncertain terms, the literature has clearly, unequivocally shown that testosterone does not cause prostate cancer. Great. There have been studies looking at men who have been treated for prostate cancer with surgery or radiation, no change in the risk of recurrence of the cancer. Right. They looked at men who have never had cancer, and there's no increased instance of cancer in those men who were given testosterone therapy. And then there's actually been studies looking at men on active surveillance. That means they have prostate cancer. They're not being treated. We follow them with close follow and expectant management. And those guys given testosterone for low T, those guys had no increased progression of their disease as well. Wow. And so we really clearly understand now that testosterone and estrogen do not cause prostate cancer. Excellent.
Good to know. I'm sure that that's a question people get asked all of the time.
Yes.
Okay, let's go through here. Such great info. That's a good question. So Mandy's asking about age ranges. So do you care about age? There's this assumption that testosterone levels and for women, right, our hormone, there's this assumption of a decline, right? And are you building in the assumption of decline with age, or are you wanting that nice robust level regardless of age?
I think the age ranges go along with this complacency that we know testosterone levels decrease as we age, therefore it's okay to have a lower level. And I honestly say bullshit. Why is that okay? Why do we just accept that? And that's part of aging. And there's this debate of, does aging cause low hormones, or does those low hormones cause aging? And so I do not look at age range. I think that all men, even up in their 70s and 80s, pre-testosterone range 200 250 is my target for them. Yeah.
Great.
And they love it for that. I mean, when you get them to that level, they feel amazing and they love it. And now they're so driven to start making some changes that they need to be making as well.
I love it.
Yeah.
Kim's asking, would supporting the consumption of healthy fats and their fat digestion, as well as adrenal health, help to increase testosterone as well as other hormones?
So I've heard this before, and my short answer is no. But I want to clarify because it's deceiving. Healthy nutrition is critical. You have to have, your macro ratios is so important. But there's this, this perception that if I eat low cholesterol, then therefore my internal cholesterol levels are going to be low. And if you think of the steroid pathway from cholesterol to pregnenolone to DHEA to testosterone, that's going to be lower. So therefore, oh my God, I'm crushing my testosterone. That's actually not true, because we know that 99% of our cholesterol is what? It's produced by the liver.
Totally.
Right. It has nothing to do with dietary absorption. It's all produced by the liver. And so we've really kind of gotten past that concept that, yes, nutrition is so critical overall systemically when it comes to, whole body systems approach to men's health. But does eating specifically a low fat diet directly cause decrease in testosterone level? We've really debunked that concept. Yeah.
Interesting. Yeah. Yeah. Best advice for boy mamas to help them grow up in this toxic world with healthy testosterone levels, aside from protecting them from plastics and chemicals? Great question.
Love this question. Yes, absolutely. And I have a 9-year-old boy, 7-year-old daughter. And so this is near and dear to my heart. Number one, no plastic water bottles. The biggest thing you can do is get rid of plastic water bottles. They're made with BPA and phthalates, which we know crush testosterone. We know endocrine disruptors cause autoimmune disease and infertility and depression and anxiety and ADHD and precocious puberty and cancers and all these other things that go along with it, but specifically crushing testosterone level. So get rid of the plastic water bottles, get rid of the plastic food containers for your food, especially like leftovers. Don't be heating up any food in plastic containers. You need to be using glass or Pyrex for sure. Try to go organic. I know it's more expensive, but if you can go organic for all your fruits and vegetables, it does matter, because our crops are sprayed with these horrible chemicals, as we know. When it comes to fish, wild caught salmon is really important that you're not eating farm raised fish, grass fed beef if you eat meat. Excuse me. When it comes to personal care products, there are a couple of great apps on your phone that are free. If you like free, then you might want to use these. One is called Healthy Living by the Environmental Working Group. Healthy Living is a green little icon on your phone. And there's another one called Yucca, Y-U-K-A, Yucca. Both of those are free. And what Healthy Living allows you to do is you can go to Target or wherever you go to shop, and you can scan barcodes. And it will tell you the ingredients in those items, and it'll tell you whether it's a good product or bad product. And you'd be shocked how all of these products that you're using are full of bad chemicals. And so that'll help guide you toward the right products to use. The biggest culprit is laundry detergent, because what's happening is you're washing your clothes with these detergents that are made of all these harmful chemicals, and you're absorbing these chemicals through our skin all day without you even realizing it. So that's a big one. Soap and shampoo, those are big ones as well. Sunscreen is massive as well. Focusing on those little choices you make each and every day, they add up over time. And so those are the big things I focus on for your kids.
Great suggestions. Great suggestions. So Anna's asking about sleep without drugs. So many people are on pharmaceuticals to help them sleep. Do you to help get them off that? Sure.
So I think avoiding any food or drink for 3 hours is really important, especially alcohol. Alcohol crushes sleep. And so especially avoiding any alcohol is going to be big. When it comes to, are we looking for supplements here or just other sleep hygiene? I know you focus so much on sleep hygiene. I don't want to bore you with
a lot on sleep hygiene.
Yeah, I don't want to bore you with that stuff.
Yeah, I think if it was this question specifically about if someone's on sleep meds, maybe how to support them to find better solutions.
Gotcha. Yeah. So there are some supplements I do like. Magnesium is massive. Obviously, magnesium, it needs to be threonate or glycinate so that it crosses the blood-brain barrier. Before bed, I love it. L-theanine is another great one as well. I know progesterone is great for women. We don't really use that much for men at all. But those are great supplements that you can use for sleep. There are some not FDA approved peptides that I use that are great for improving growth hormone. Growth hormone surges at about midnight. And that's really important for good quality sleep. And so a lot of the men and women, and I would say actually women probably respond a little better than men do actually to the growth hormone secretagogues that will massively improve quality of sleep. And so that's another hack, having to prescribe peptides to do that. I know your community doesn't do that, but yeah, L-theanine and GABA is another great one as well. Magnesium would be my kind of go-to supplements that you can use.
Thoughts on Viagra and how it might impact sleep?
So I love Viagra and Cialis, not just for sex. I like it low dose daily. There was actually a study that came out, this is maybe a month or two ago now, that actually showed that men on Viagra had a lower risk of a cardiovascular event.
Wow. Who knew?
Why? I think that is probably related to nitric oxide. So remember, mechanism of action here, whether it's Viagra or Cialis, what they do is they increase nitric oxide production. And you can take nitric oxide supplementation. What these do is they block the breakdown of nitric oxide. And so by inhibiting phosphodiesterase enzyme, which is what breaks down nitric oxide, it increases levels. Both locally where you need it for sex, but also there's some systemic effect there as well.
Amazing.
And so,
oh, sorry.
Yeah, I'm sorry, but for sleep, I don't know. Short answer is I love it in general, but I don't typically think of it as used for sleep. I'll have to, maybe whoever Kim can expand on the question what her thoughts are there with sleep. I've not heard it being used for sleep, but I'm now intrigued to want to go research that to find out. Maybe it allows you to have sex, which is then going to put you to sleep. Maybe that's what it is.
There you go. I realized I skipped one here. Laura asks how gut health affects testosterone. Laura, you're going to want to do our hormones class, but let's give the quick.
Yeah. So I think that this is an indirect effect. It's not going to, in my opinion, necessarily directly lower testosterone. It's going to be more its systemic effect when you have, leaky gut, when you have inflammation as a result of it, of poor gut health. I think it's going to have an indirect effect on testosterone.
That makes sense.
Yeah.
Great question here from Courtney too about mitigating impacts for men who have to travel long distances semi-regularly for work. I'm sure you see that a ton in your clientele. How do you get that? We talk about the consistency and this staying on the same schedule. So how, when they're traveling a ton and all the schedules go out the road, how are you supporting them in that?
I have a lot of guys who travel quite a bit for work, and there are a couple of hacks that I would say. Number one is fasting. That's the time. And is this question related to flying or just driving long distances to go to work?
I think it's, the way I'm reading the question is that, if they're traveling a lot or, maybe driving, maybe flying, I'm not sure that it matters, but just I'm thinking like all the things that they have to do when they're on the road. Sure.
So I would say that there's a lot of fitness work that you can do your own anywhere, body weight stuff in a hotel room that you don't need a gym necessarily. Most hotels have a gym as well. So you can always find equipment. There's never a lack of time to do a training. So when guys are traveling, I make them commit to the same workout routines that they have at home. The time of day may need to be a little different to accommodate if they're, in flight or whatever, but otherwise you need to keep consistent with that. When you're traveling, that's a key time to fast because you're never going to find good quality nutrition when you're on the road, whether you're stopping at gas stations or whether you're on an airplane. That's the key time to fast. You just cannot eat during those times. So that's the big one. And then my big hack for traveling is bring your own pillow. Massive difference for just improving the quality of your sleep when you have your own pillow versus hotel room pillows that you're not accustomed to.
Great strategies. Where can we as female practitioners learn more about men's health and hormones, like resources and courses? And she says she did read your book, Male 2.0. Awesome.
That's a great question. I am working on my practitioner training program currently. We have one location currently, but I'm working on expanding to location number 2 next year, and then hopefully 3 through 10 over the next few years after that. And so I'm making the training manual that's going to go along with that because we have a team. I have 11 employees and 4 or 5 health advisors, I call them, which are FDNs and one RWP. And so I'm trying to create a standard process that we employ for all of our patients. So the answer is I'm building that currently. I don't have anything available for you just yet.
Let us know. Let us know. Ellen is asking about intermittent fasting.
Yeah.
And
love intermittent fasting. Amazing benefits. I think that was a New England Journal article that came out last year. I thought was terrible, and I thought it really did a disservice the way it diminished the benefits. It's not just on direct fat loss. Like if you do intermittent fasting during 3 months and just measuring that fat loss during that time, it doesn't honor the fact that it is improving insulin sensitivity. It's improving hormone production. It's improving autophagy. It has so many physiologic benefits that that study didn't even address. And so I think that was a shame. Love intermittent fasting. I tell anyone who's never done it that you need to start just 1 day a week, get started. And then once guys are doing it for a month or two, I'll have them go to 2 days a week. And then I push to typically 3 to 5 days a week is my target for that. I think that doing it 7 days a week is too much. I think you may be stressing yourself too much at that point. So I like 3 to 5 days. I'll typically do 5 days of fasting a week, Monday through Friday. And one of those will be a 24-hour fast. The others will be 18 hours. And I want to emphasize that to do intermittent fasting, minimum 16 hours, 12-hour fast does nothing for you. You have to hit at least 16, preferably 18 hours for it to be beneficial.
Yeah. Mary's asking if you work with adolescent boys over 12 who are having trouble with growth.
I don't typically. I saw one 13-year-old boy a few months ago. He was actually the son of one of my clients who I've been treating for years, and he was telling me how his son was having recurring sinus infections. And he's been to multiple ENTs. He's been on every antibiotic you can imagine. Nothing's working, and the kid's miserable and recurring sinus infections. He's missing school. And I was like, Ken, it's probably his gut. And he's like, what are you talking about? I'm like, Ken, it's probably his gut. And he's like, he's blown away. So I managed this one boy by cleaning up he had massive gut issues, of course, when I tested his gut, cleaned up his gut. And what do you know? His sinus infections are gone. And so it was this miraculous transformation for him, really just by addressing his gut. So that was my foray with managing adolescent boys. My N of one. That's typically not what I do. I typically work with guys, typically age 30 to 60, looking for those 4 things we talked about earlier.
Right. I want to respect your time. Also, I'm going to ask one more of the questions here, and then I have a last question that I want to ask as well. So just Julie's asking about maca for men to help with hormones. That's the one we hear about a lot. Yeah.
So maca is an herbal. It has been shown to potentially improve testosterone. I think the data out there is sketchy. Does it work? Maybe. It's a little unclear. But there are a lot of testosterone boosters on the market. Most of them are crap. And a lot of the herbals don't help much for boosting testosterone. Maca may help testosterone somewhat. Yeah.
And actually, I just see another one here in a similar vein, DHEA as a support for testosterone.
Okay, so I love DHEA, massive benefits as a hormone in and of itself, and I forgot to mention that earlier. Typically, about 250 is my target for DHEA for men. So many men have low DHEA levels. Excuse me. However, when you supplement with DHEA, it will rarely ever bump the needle on testosterone very much. You don't tend to see much movement in testosterone. When I give DHEA, though, I want to just emphasize that a lot of times their DHEA sulfate will not move at all. And that's when I start looking at the gut. That's probably inflammation in the gut causing sulfation problems with DHEA.
Awesome.
Okay. Yeah. I see a question on vasectomy. I did my own vasectomy, so I love vasectomies.
That's right. I forgot about that. Oh my goodness. Okay. This has been a fantastic. I want to ask you, I'm just going to change gears a little bit here, as we were talking about earlier, because you have brought in successfully several other clinicians, one of whom is a restorative wellness practitioner, onto your team, which is wonderful. And what I would love, because we have a lot of clinicians here who would love to work in a functional medicine practice like this. Some people want to go out there and hustle and build their own business. Others they just want to do the work, right? And they would love to be working as part of a practice like that. Do you have, it's working really well for you. And I would love your thoughts as a functional medical doc. Like, what are the factors that make it so successful that the practitioners in our community can be thinking about when, if and when they decide they want to apply for that kind of a role in a medical practice?
Yeah, great question. I think the key is to have a collaborative approach and mindset, and that the three FDNs and RWP that work with me, they know that they're part of a team, and they know that we're working together on this client, and I'm providing the medical services, hormones, peptide supplements, and then they're providing the accountability, the lifestyle support, as well as the functional testing. So when there's GI maps, food sensitivities, cortisol, organic acids, any of that stuff, I let them manage and run those. And then they will give recommendations on supplements, and then my team will help facilitate that. But I think it's really at the Gapin Institute, we have 5 values that we think are really important. It's integrity, authenticity, empathy, growth mindset, and collaboration. I almost forgot them. And so I think having those core values, I think to me, is what's really important. And the ultimate goal is obviously to provide an amazing patient experience or amazing client experience. I shouldn't use the word patient around, but so providing an amazing experience from start to finish is really our goal. And so I think having that mindset, I think, is really key. I know a lot of RWPs want to do it on their own, and that's great, and run your own practice, and that's awesome. For me, I could not achieve what we've done in the year and a quarter since we launched. We've exploded, and it's because I have an amazing team that works with me side by side.
I love it.
Yeah.
I love it. Thank you so much. This
of course, anytime.
Fantastic wealth of knowledge. I took copious notes myself. This is a wonderful, just so many great resources. Any last words? Anything that you want to say?
I appreciate the opportunity to speak with your group. If anyone has any questions for me, you can feel free to email me. It's doctracy@gapininstitute.com.
Thank you so much, Dr. Tracy. Have a fantastic evening, everybody. Take good care.
Thank you.
Bye-bye.